We'll be reviewing the Hovermat. If you reference your quick mobility screen, this is that top row specific to bed mobility. Always look at mobility first. If a patient is max assist, consider using the Hovermat, or if the patient needs assistance in bed and they are considered a bariatric patient, use your Hovermat. Please always reference the label. The label has some basic information on there, such as using at least 2 people, lock all your wheels, ensure the patient is flat, center the patient, and that's what that little red dot there is indicating. Fasten the safety straps. So when you're doing a lateral transfer, the safety straps are these 2 straps here. Leave them somewhat loose because it is going to inflate about 3 to 5 inches. Keep a stay close approach. Always deflate the Hovermat when you're done moving the patient and put the side rails up. The last little pictogram is showing you the connecting straps. So if you notice, at all 4 corners, you're gonna have a pocket, and inside the pocket's going to be this strap. When you are not moving the patient, you anchor those straps to the footboard. There's 4, so 2 at the footboard, 2 at the headboard, and always tuck them back in so that you do not have a hazard. One there. There's the other one into that pocket. You're gonna need a pump to use this. You have 1, 2, 3, 4 buttons on that pump. The button on the left is adjustable. That's good for centering the patient on the Hovermat or looking at their position. Standby, you see how it's illuminated. That's how we know it's plugged in, ready to be used. You push that and it turns the air off. If you notice above the 2 buttons on the right, it says Hovermat. What button are you going to press to inflate the patient? It has a number above it, and if you look at the label, there is a number on the label. So you know you're gonna press the 34-inch Hovermat button. The hose must be inserted into one of the ports, and you have 2 ports. There is a snap, so please make sure you snap it into place. It points towards the patient's feet. That way it allows you to close that port and all the air can go into the Hovermat. Now we're gonna prepare for a lateral transfer, so we've put both surfaces together. We have 4 handles on each side, one about at the head, the shoulder, the hip, and the ankle. You're gonna start getting the patient's head over. So when you are on the receiving side, you do not reach over. You wait until the person pushes the patient's head and shoulders over, and those handles are within a comfortable reach, having one foot in front of the other so you're keeping your back straight and avoiding bending from your back. Are you ready? All right. We're gonna turn that Hovermat on. Always make sure somebody is right at the bedside so that the patient does not fall off of the gurney or the bed. Pushing that 34-inch button. So it takes a couple seconds to inflate. Once you see that patient is no longer rising up, you know they're there. Go ahead and push at the head and the shoulders first. And then lock your body down to avoid twisting your spine. And bringing that side rail up, ensuring they're centered on the mattress, pushing that standby button to turn it off.